Carry on. So we're going to look at the guidelines for prenatal yoga practice. So first, looking at what are the most important guidelines to remember when practicing asanas. So the first thing to note is there shouldn't be any compression, strain, or overstretching of the belly in any way. So you can apply that to many different types of asanas, and then you'll get a good understanding of whether it's going to be suitable or not. Then the next point is that we should be practicing with the baby's safety in mind at all times. Now, when you do look at prenatal yoga, if you Google it, for example, you'll see all sorts of stuff coming up. And a lot of the practices that are being done are not thinking about how that baby is inside. I mean, you'll see things like handstand scorpion in the 9th month of pregnancy. And for that lady to be doing that, okay, yes, she can do it, but how is the baby inside? How is her body feeling when she does that? So we have to really think about the care and respect of the baby and also of the mother. Now, physically, she might actually be able to do it, but it doesn't mean that it's actually suitable for her to do. So we also have to remove a bit of that ego away from the asanas that we practice and have a practice that is suitable. So next you can see the point, yoga should not be practiced in the same way or just for the benefits of the woman. So like I was saying, once a lady is pregnant, she is caring for two. So she has to practice yoga in a way that is looking after both of them together. And the pregnancy yoga asanas are going to be much more suitable for her and are going to give her the benefits that she actually needs. And moving to the next point, you can see pregnancy is not a time to learn new, more difficult or advanced poses. In fact, it is a time to learn new poses, definitely. Many of the poses that I learnt in pregnancy, I'm using now, and I'm teaching to many people who are not pregnant also. But it's not a time where we say, oh, okay, now I've got a few months free. I think I'll just work on that crow pose, or I'll just work on, doing this other advanced asana. That's not the time. It is a time to be gentle and caring to your body and to give respect and love to yourself and your baby because you're growing a child or your student is growing a child. So that needs to be respected. So looking at the asana guidelines, so we want to do asanas that are going to be creating space and openness in the body because there's not a lot of space there. When a baby is growing, the lady can feel very constricted in her movements and she can feel that she needs that bit more space. So we want to open up the pelvis, so create space in the pelvis. We want to create space in the chest and the upper back as well. So many asanas will be doing that. Then all asanas should be comfortable. So we don't want there to be any kind of strain or overexertion on the body. And each person is different and each pregnancy is different. Anyway, asanas should always be comfortable, whether it's prenatal or a regular class. There shouldn't be pain. We shouldn't be forcing ourselves into poses or pushing ourselves. That goes against the yogic principles of Sthira-Sukhamasana. So we want to be comfortable, but every woman feels things a little bit differently in pregnancy. So certain pose that maybe one woman feels really good in, another doesn't. And that's absolutely fine because we have to be flexible in our class and we have to adapt according to each of our ladies in our class. And each pregnancy can also be different. So for example, one lady might, in her first pregnancy, she was really happy to do lots of asanas. She felt really good to do something a little bit more dynamic. Whereas the second pregnancy, she's not very interested in asana. She wants to go inward. She wants to do meditation. She wants to do pranayama, yoga nidra, and that's fine too. So it is important that we adapt to each of our ladies. Then we have the relaxin, which is released from the placenta. Now, this is helpful because it prepares our body for the time of the birth. So it helps to open up the pelvis, get the birth canal kind of ready, but there are some problems related to that, that some people can have too much of that released, which can make their pelvis very unstable. So it means that they can have a lot of flexibility in their pelvis, but they might not have the strength in all their muscles. And that can create a lot of problems, like they can have back pain, pelvic pain, all sorts of things. So that's one issue, and that's where we also don't want to do lots of pelvic opening, because they're already getting open. It's like the body says, oh, okay, I'm going to be giving birth, so relax everything. So this can be an issue, but the other issue can be if there's a lot of relax and released, and for example, maybe a woman's been doing yoga for a couple of years, and maybe she couldn't touch her toes, and now she can, and it can be quite exciting, and she might overdo it. So that's another thing that we need to take care of. And this is something I also remind people about, that many people say, oh, if I don't do these asanas when I'm pregnant, then I won't be able to do them afterwards. Like, I will have lost that ability to do it. But it doesn't work that way, because for a start, you pretty much stay just as flexible, and you can do a lot of things for flexibility anyway in pregnancy. So you've got the relaxing, which can be helpful. And the other thing is that you don't lose it. Like, if I don't do an asana for 9 months or 1 year, okay, when I go back to it, it might be a little bit tough to start with, but it won't take long for my body to remember and to be able to achieve that pose again. So it's not a big deal to not do a pose for a period of time. And really, is 9 months or 1 year or even 2 years in one's life really going to have such a big impact, for not doing that pose? So that's one thing. And the other thing is that many women's practice does change postnatally. So, a woman who was, before she became pregnant, she might have been into doing lots of different types of asanas. And then through pregnancy, the practice changed. And then afterwards, she might have just not be interested so much in doing different types of advanced asanas. Often the priorities change, the focus changes in one's yoga practice, and that's completely normal, and that's also fine. So that's a bit about the overstretching. And then we want to avoid strong twists. So any kind of really strong twist is going to be compressing the belly a lot. So instead of doing those really strong twists, we do open ones. And there's a lot of options for doing open twists that are really, really nice and really beneficial. And it might be that you just adapt certain classic poses. For example, if you would normally do Ardha Matsyendrasana, the half spinal twist. So normally you would bring your arm over and you would be pretty much compressing your belly. Whereas you can twist the other way and you can still get a twist on your spine, but the belly remains good. The belly is not getting too much strain or too much stress. There will be a little bit of pressure on the belly, but it's not strong. So a lot of the time we can do open twists instead, and they're really good. Then the next point is no abdominal contractions. So here I mean strong abdominal contractions. Definitely you are going to be doing abdominal work. You're going to do core work. It is essential to do, because we need to have a really strong core, not just for pregnancy, but also to make the postnatal period a little bit easier, to make the recovery faster, and also to prevent things like back pain. But we don't want to be doing super, super strong abdominal work. We want to pretty much work the internal muscles, not just the outer muscles. So, things like sit-ups and all that kind of stuff you don't want to be doing. If you are doing, say, Uttanpadasana raised leg pose, so it might be that you, instead of doing the double leg pose, because it makes your legs shake, which is definitely too much, you could do the one leg raised pose, which is still going to give you benefits and strengthen your core. Now, there's lots of asanas we do to strengthen the core, things like Ardha Chakrasana, the half wheel pose or the bridge pose. Some people call it the bridge pose. We do that. We do things like the cat pose or the one leg cat pose. All of that is definitely strengthening enough, but we don't want to do practices where our body is actually shaking because it's so intense and we can feel it in our abdominal muscles. We don't want to do that. Okay. Then we want to avoid the strong back bends. So any strong back bends are going to be having a really strong stretch onto the belly. And also in pregnancy, there is a tendency to have that arch in the lower back. So it's not actually as necessary to have a lot of back bends, for the lower back at least. We might want to do a little bit for the upper back, but for the lower back, it's not needed so much. In fact, the alternating, like in the cat pose, is more beneficial because you're getting that little back bend, but then you're getting that little curve. So that kind of thing is really nice. I remember in one of my pregnancies, I decided I was going to do a pigeon pose. Now we do pigeon pose in prenatal, but we don't do the full one. And I thought I'm just going to see how far back I can go, just out of interest, you know. And some of you know me, so you know that my back bends are pretty okay. I can extend quite far. So I noticed that I couldn't bend far as much as I could normally, and I felt that it was my abdominal muscles. It wasn't, you know, my back muscles. They were fine, but my abdominal muscles had contracted, basically because they're there to protect the baby. So there is some contraction in the belly to protect. So of course I could have continued to do it and I could have stretched and I could have got into that if I wanted to. But just to experiment and see how the body feels, it's interesting that the body naturally does that to protect. So we can do, say, things like Natarajasana, the dancing Shiva pose. You can do that kind of thing, but it doesn't have to be the really intense one. It can be more of a gentle back bend. And things like Ustrasana, the camel pose, we can do that position. Generally, we do the half version, but that kind of back bend we can do. But as I said, the stronger back bends we're avoiding, and they're also not needed. Now, the last point on this slide, avoiding prone position from the second trimester. So basically, from the second trimester is when the belly is going to start to protrude. For some women, it's early in the second trimester. For some, it's much later in that second trimester. So every woman is going to be different with how she shows. You know, for some women, it's just the 4th month and you can already tell that they're pregnant. And other women at 6 months, you still can't really tell. So it will be different for every woman, and also each pregnancy will be different. Many women, their first pregnancy, they don't show as quickly, whereas the second pregnancy, they start to show very early on because they've already gone through this, but their body already knows. It's like, oh, I'm pregnant, everything comes out. So we want to avoid prone from the second when the belly's starting to protrude because we don't want to have that compression. But in fact, many women in their first trimester also don't want to do prone position. So prone position, laying on the belly. Now, there's a few reasons for this. One is because a lot of women do have tenderness of the breasts, and laying on their chest can be very uncomfortable. And for many women, it can be their first symptom of pregnancy. And the second reason is psychologically. Many women don't want to lay on their belly because they're worried about affecting their baby. Even though baby is tiny, still they worry about that. So they don't want to do it. So, you know, for those in the first trimester that feel comfortable, they can stay in it. I've noticed that a lot of women by the second, if they've had a second pregnancy, they're much more comfortable to lay in prone because they kind of want to stay in prone as long as they can because they know it's going to be months until they can come back to prone position. But especially first pregnancy, many women can be a little bit concerned about it. Now, next, looking at laying on our back. So here you'll see the picture of the inferior vena cava, or some people say vena cava, and that's one of our main veins, which is bringing the blood back from the lower extremities. And if we lay on our back, then this can be compressed by the baby, and it can make her feel uncomfortable, dizzy, nauseous. It can make her feel faint. It might just make her feel not quite right. So that's the reason that we stop laying on the back if it doesn't suit her. Now, for some women, even from 20 weeks, laying on their back does not feel comfortable at all. And for some women, they actually feel comfortable the whole 9 months. So you really have to go individually. If it is into the last trimester, I would generally avoid laying on the back for very long. Just to lay on the back for a couple of movements is fine if they feel good, but not for extended periods of time. So if you're going to do like a yoga nidra or a shavasana in the 3rd trimester, it's better to take another option instead of the back. So you can see the blue, which is the vein. So you can see under that supine picture there, that compression that the baby is being put onto it. Whereas if we lay on our side, so if we lay on our left side, there's no compression at all being put onto that vein. So that's why we often do a side shavasana where we're laying on our left side. And you probably heard that cockatoo, that was really noisy. That will take that pressure off. Okay. The other thing we often do instead of laying on the back is that we can lay at a 45-degree angle, so that can also take the pressure off. And one of the other reasons is for some women, if they start putting on a lot of weight, their baby's growing really fast, their belly's really big, then there's a higher chance that they're going to feel uncomfortable to lay on their back earlier on. Whereas a lady who only has a small bump, she will most probably be comfortable to lay for a longer period of time. So continuing with those asana guidelines, so we're avoiding laying on the back from the 2nd trimester, say the middle of the 2nd trimester, not the beginning, if it feels uncomfortable or causes dizziness. Okay, so here you can see this other point, lying on the left will increase the oxygen. Now, the next thing we do is avoid inversions. Now, this again is quite controversial. Google prenatal yoga, you'll see all sorts of stuff. You'll see lots of headstands, you'll even see handstands, you'll see Sarvangasana shoulder stand, Viparita. So it's from our point of view, we avoid the stronger inversions. One of the reasons is the pressure being put onto the vena cava. The second is that it can, if you're going upside down, you don't know exactly with that movement what's going to happen with the cord, so the umbilical cord in the womb. Then also it puts strain on the ligaments around the uterus, so holding the uterus in place. It can also be a problem for any woman who is feeling nauseous, or if she's having any vomiting, it will definitely make it worse. If she is having any heartburn, it's going to make it worse. If she has high blood pressure or any kind of heart problems, it's going to also cause a problem. So there's lots of contraindications related to inversions. And another reason is because it directs the prana upward, whereas we kind of want the prana to be staying there with the baby. So we avoid those strong inversions. So things like the shoulder stand, the headstand, Viparita, the inverted pose. We do other inversions. So we do things like downward dog. We do Ardha Chakrasana, the half wheel, or the bridge pose. We do forward bend, standing forward bend. We do Ugrasana, the ferocious pose in standing. So they're inversions that we can be doing as long as it feels comfortable for the lady. And of course, there's still precautions for those as well, but they're not as strong. And for some women, if they want to do a supported version of Viparita, so using a bolster and the wall, then that can also be okay. But of course, again, more precautions are there. So it is important that we are taking care with which types of asanas we are going to do. And of course, if we've got a regular class and we've got a pregnant lady and you're going to do the headstand or the shoulder stand, you can get them to put their legs up the wall and they'll still get a lot of the benefits. Okay, then we avoid holding positions for an extended period of time. The positions I'm talking about here are strong positions. Okay, positions that can be strenuous. I don't mean relaxation asanas or restorative asanas. I mean, okay, we want to do Trikonasana triangle. Okay, we might hold it for 20 seconds, 30 seconds. We're not going to hold it for 2 minutes. We're not going to do Virasana Warrior for 2 minutes. We can do those poses, but not for so long. So if we're in a restorative pose or a really supported pose and we want to hold it for longer, maybe we want to do child's pose, Shashankasana. We can hold that for a couple of minutes, even 5 minutes, even more than that if we want to. But we don't want to do poses that are going to be really strenuous on our body, which can make us feel dizzy or tired or faint. So that's what I mean. Then the next point, care should be taken for moving from supine to sitting and to standing positions, and should always be done very slowly. So for example, if you're going to come up to sitting position from supine, so normally we come up onto our elbows and then come up to sitting. So it's recommended that you roll to your side and then come up to sitting. You're also going to do these things slowly, because if you move very fast between positions, it can also make her feel dizzy. Also, because if she's not eating very regularly, she can also feel a little bit faint if she moves very fast because of her, the dip in her blood sugar levels. So we do roll to the side. The other reason is that if we come immediately up from laying down on our back, we're applying our core muscles very strongly, so it's kind of like a sit-up, and those kind of practices are not recommended either, because they can also be linked to diastasis recti, the split abdominal muscles, which we'll talk about a little bit more in our postnatal classes. So it is important to take care of how you're coming up to sitting. Then it's also important how you're coming up to standing. Now, there's no set way that you have to come up to standing. Every woman kind of comes in her own way. More important is that it's going to be slowly and carefully. Now, the last point here is avoiding squatting positions if there are complications or the last few weeks of pregnancy. So many of the squatting positions, in fact, squatting positions in general are very good in pregnancy. They help to open up the pelvis. But if there are certain problems, like there's a chance that baby's going to come early, then the squatting positions can also encourage that. So that's the time to avoid a lot of squatting. If there's any kind of indication that baby might be coming, like maybe she's starting to feel a lot stronger contractions of the uterus, or maybe the cervix is starting to dilate, so that kind of thing, which can indicate that baby's going to come. Now, we really don't want baby to come before 37 weeks, so we want to keep baby in for as long as possible. So that's why I write also in the last few weeks of pregnancy. Of course, if she's up to 40 weeks and baby hasn't come yet, which is of course very normal still, because most babies will come at 41 weeks. That's the average. They say the average for the first baby is 8 days late, which is 41 weeks plus 1. And for second baby, the average is 3 days late. And if you look in different countries, now there are a few different ways of calculating, but in some countries, 41 weeks is actually the due date, like in France, whereas in other countries, it's 40 weeks. So once they get to their due date, doing a little bit more squatting could possibly help with moving baby downward. So there's benefits to the squatting poses too. But yeah, definitely if there are some issues and it seems like baby might be wanting to come early, we avoid those squatting. So now we're going to look at some more specific pregnancy conditions or complications and things that we need to be careful about. Now, you've already had the lecture about major kind of complications and emergency situations. Now, most of that you would never be dealing with, and a lot of those things are not very common at all. But these are some of the things that you need to be aware of. So the first thing is about bleeding. So we avoid the asanas until around the 16th week or when the doctor allows, if the bleeding is there. It is very common, but if there is bleeding, it is important that your lady does check with her midwife or her doctor to make sure that everything is still fine. It might be that she needs to have an ultrasound just to check, or just to listen to the heartbeat to check that everything is okay. So if that is happening, we want to do things later. Of course, it doesn't mean she can't practice yoga. She can do a lot of relaxation. She can do some gentle movements. She can do pranayama, meditation, all of that. But stronger types of asanas, we want to do a little bit later. Next, looking at breathlessness. So avoiding laying on the back for too long. And especially when a woman is getting a little further into her pregnancy or her belly's very large, then that laying on the back can make it feel worse. So especially having like a 45-degree angle can be really good for that breathlessness. It's usually not there until late second trimester or third trimester, but of course it does depend on each lady and also the condition of their lungs beforehand. Now looking at breech baby. So if you see the picture, the normal position in those last few weeks is where the head is down near the cervix and the bottom is up high with the legs. Now the breech position is where the head is up instead and the bottom is touching to the cervix. So it is important that if the baby is breech, we don't do things like squatting positions because we don't want the baby to move even further down deep into the pelvis, because it will be much harder for the baby to turn if the baby's moved down. So here basically the last 6 or 7 weeks is when the baby moves into its position. It can be also hard for the baby to turn afterwards because there's not a lot of space. Now you'll find that throughout a pregnancy the baby turns and moves and does all sorts of acrobatics in the womb for a lot of the pregnancy, but then those last 1 to 2 months there is not a lot of movement, as in full turning. Definitely there's movement, there's lots of kicking, elbows, all that kind of stuff, but not the full flipping over. So that's basically because the space just isn't there anymore. So we don't want to do anything that is going to make the baby kind of engaged, which is where the body's moving further and further down into the pelvis. There are poses that can help with turning a baby. So things like Ardha Chakrasana, the half wheel, Pawanmuktasana, the gas release pose, Viparit Karni, the inverted pose with support of bolsters. All of those can be helpful for turning the baby if it's necessary. Of course, there's other things like acupuncture that is used for turning. Sometimes manual turning is also done by a midwife. So there are options. And we want to try to avoid breech position if possible, because a lot of doctors and midwives these days, they don't want to deliver a breech baby. And in fact, many of them have lost that skill of delivering a breech. So next, looking at carpal tunnel. So carpal tunnel syndrome is not specifically related to pregnancy, but there is more of a tendency towards it in pregnancy. So for that case, where the pain is there in the wrist and into the hand, we want to avoid too much movement of the wrist there. Well, we can do movement, but we don't want to have strong pressure being put onto the wrist. So things like cat pose, downward dog, all of that, plank position can be too strong on the wrist. So we just want to have really nice gentle movements, gentle ones, to relieve any tension there. Then next, looking at the cervical stitch. So this is where there's a stitch at the cervix, and you can see that picture above. where there's the open cervix and then there's a stitch that's being put. Now, different countries have different ways of looking at it. In some countries, they put a stitch in early, so even in the first trimester, and one of those reasons is, well, the reasoning is to avoid miscarriage. I don't fully agree with that, because to me, if the miscarriage is going to happen, a stitch isn't going to stop it. Another reason is where it's done a little bit later, so in the 5th or the 6th month, is when the cervix seems to be opening a little bit. Now, it should be closed. It should stay closed for the pregnancy until the pregnancy is almost over and the time of labor is beginning. But for some women, the cervix can just open slightly. That can be because the belly's really big and heavy, and the pelvic floor can be not as strong. So that's where a stitch may be put in, just to try and hold everything together for as long as possible. And usually that stitch is going to be taken out from around the 37th week. So it's important to avoid that full squatting, because that can put too much pressure onto the cervix, and many women will feel uncomfortable. Even for some women that do have that stitch, any kind of strong pelvic opening can be uncomfortable, even things like butterfly pose. So you have to go with the individual and see what is suitable for them. Then we look at general back pain. So we avoid any strong positions, particularly, of course, any strong back bending there. We have to take care with the forward bends as well. So if we want to do a straight leg forward bend, then we have to take care that we are going to be starting with our bones on the floor and then tilting very gently, so that we're not going to be hunching. And using cushions if needed, but especially taking care with positions and postures, how we're standing, how we're sitting. Keeping the feet parallel is definitely helpful. If you're turning your toes out, that's going to cause more compression onto the lower back, which can create pain. Also, for some women, they will put more pressure onto one foot than the other. And also, some women have a tendency to, put their hand on their hip and push their belly out. So that's making their lower back arch, which can be a continuous arch, which also creates back pain. And then, of course, avoiding laying on the back for too long. So for some women, to do a yoga nidra laying on the back for half an hour is too much. In fact, it can be too much for many people who are not pregnant. So they might need to take another option like side shavasana or Matsya Kritasana. Now moving to hemorrhoids, of course, there is more of a tendency towards hemorrhoids in pregnancy, mostly because for some women they do have more constipation, and that leads to the hemorrhoids, from trying to evacuate. High blood pressure and preeclampsia. Now, Dr. Dawley has talked a little bit about that. So for most women, if they do have high blood pressure, they know about it, and many times they won't be coming to a yoga class. And especially if they have preeclampsia, they will be recommended bed rest, and they won't be doing a regular yoga class. But they might ask you, what should I do at home? So we don't want to do any kind of inversions. So even things like downward dog, any kind of standing forward bend. I wouldn't even do child's pose with the head down either. Child's pose with the head up, okay. So anything that is uncomfortable. Obviously with preeclampsia, it can be very serious, and many times they won't be doing any movements at all. So that's where pranayama, meditation, yoga nidra will be really, really helpful. Because if the preeclampsia is there, there's a much higher chance of complications and also having a cesarean section. Now, looking at IVF pregnancy, so we also want to avoid doing any kind of stronger asanas until the 5th month, or to make sure that the pregnancy is going to be fully established. Now, of course, certain movements can be done, some gentle asanas can definitely be done, but a lot of the focus should be on stress relief, because to have an IVF pregnancy, you already know that a woman has gone through possibly years of trying to become pregnant, that already accumulates a lot of stress and a lot of anxiety can be there. And then finally, to have an IVF pregnancy, she might have gone through many cycles of IVF as well. She might have had miscarriages too. So she's definitely going to be very nervous about the pregnancy, very stressed about it. So she needs to have a lot of relaxation. So you wouldn't be doing any kind of strong asanas. You want to do a lot of relaxation, like guided meditations and pranayama and yoga nidras and simple types of movements with the breath. That is going to be most suitable for her. And also, we all know that there is a tendency to having twins in IVF, so even more care needs to be taken with what kind of practices are being done. Now, looking at low blood pressure and faintness, so we want to take care. Now, a lot of women do have more lower blood pressure, more cockatoos going past. Of course, some women have a tendency to high blood pressure or to preeclampsia in the third trimester, but a lot of women will have low blood pressure, and it is very normal to have low blood pressure. We all know that the regular blood pressure is 120/80, and it's pretty normal for it to be 100/60 in pregnancy. But for some women, it can drop even more than that. And so that's also where it's important that they are eating regularly enough so that they will feel more comfortable. But we do need to take care when we are moving positions. We don't want to be standing for too long. We don't want to lay on the back for too long. And especially even things like child's pose, if the head's been down for a while, we want to come up very slowly and very carefully. Okay, now fluid retention. And I'm sure as soon as you saw this slide, you looked straight at those feet and went, oh my gosh. So that can happen. There can be fluid retention. It's most common in the ankles and the feet and in the hands. Especially a woman who is on her feet a lot, she can have more of this fluid retention, especially if she's not doing as much kind of exercise and movement, and also it can be a side effect of things like high blood pressure. In fact, it can be even more extreme. I tell you, a friend of mine, she was carrying twins and she was healthy the whole time until she got to 37 weeks, and then she got preeclampsia, and her legs were just like tree trunks. So all the way, the thighs and the calves, everything was the same. There was no differentiation between her legs. It was full on. So if it's like that, no woman is going to be going to a yoga class, because that is a very extreme version of fluid retention. But many women will have just a little bit in their hands, in their feet, sometimes in their face. So you do need to take care about what kind of movements are going to be there, and you don't want to be putting pressure onto those areas. Definitely for the feet, putting the legs up is going to be really, really helpful. Not all women can lay on their back and put their legs up, so you might have to do like a 45-degree angle, or even if they're laying on their side in a side shavasana, putting their feet up a little bit onto a bolster or a cushion can be helpful. But you have to take care with things like even Vajrasana. So Vajrasana thunderbolt pose can be uncomfortable if there's swelling in the feet. And it's also not recommended to have so much compression there. So you do need to adjust poses accordingly. Then looking at miscarriage. So if a woman has had miscarriages before, or if there have been some signs that she might miscarry, then she needs to avoid any of those strong asanas until around the 16th week, or at least the first trimester of her pregnancy. Now, many women will anyway not come to a yoga class in their first trimester because they're concerned about miscarriage. Something like 20% of women do have miscarriage, so the first trimester is actually really important to be very careful. But definitely some women have gone through a lot of miscarriage, so their pregnancy is really, really important to be very gentle and do a lot of stress relief, just like the IVF pregnancy, basically. So example of high risk might be if they have been having bleeding, if they have been having pain in their pelvis, that kind of thing means there's a higher chance of miscarriage. And of course, one of the good things about working with pregnant ladies is that they are communicating with their midwife or their doctor very regularly. So if there's ever a time where you're not quite sure, you can always say to them, please go and check with your midwife before you come back to the class, because you want to make sure that there's never going to be any kind of problem. Okay, then we move to palpitations. So that's where the heart can be racing. So that can be if things are a little too strong. So here I write avoiding any poses that are strenuous. So especially things like standing poses that might be a little bit too intense. Palpitations can be there also because of anxiety. So that might be where you do a little bit of pranayama or some yoga nidra or some relaxation, and that can also be helpful. Then we look at placenta previa. So if you look at this bottom picture, you can see the normal placenta. You can see, which is that red bit at the side. Then you can see the partial placenta previa and a major placenta previa. So that's where the placenta is down below and it's basically blocking the cervix. So if that happens, then a woman cannot give birth naturally because it's going to create bleeding and it can actually be very, very, very serious. So it's not very common. A lot of women will have a low-lying placenta. Something like 10% of women have a low-lying placenta, but then as the belly grows, the placenta also moves away from the cervix. Now, most women will know, and it won't be until their last trimester, because of course the baby's growing, the belly's growing, the placenta's moving, until their last trimester, that they know if that placenta previa is there. Usually what happens is if the placenta is low-lying, say at the 20th week when they do that regular ultrasound, now most women will have an ultrasound at 19 or 20 weeks, they'll say the placenta is low-lying, and then from about the 32nd or the 33rd week, they'll have another ultrasound to check where it is. So it is important that if that placenta is still laying there and blocking the cervix, we don't want to do any kind of asanas that are going to be moving baby downward, because there is a tendency that baby can come early. And if there is going to be placenta previa, they have to have a cesarean. There's not an option, as I mentioned. For some women, they might start bleeding, and it can be quite early, and that's when it's really important that they go straight to the hospital, of course. But we don't want to do squatting poses or anything that is going to move baby down and possibly start that process happening. So this is placenta previa. Then if there's any kind of pelvic pain, we want to avoid wide leg positions. We want to take care of all poses that they're going to be very gentle. The pelvic pain can be there, especially if the pelvic floor is not strong, or if there's a lot of pelvic instability, like I was mentioning. A lot of opening is occurring. So we want to avoid all that kind of pelvic opening asanas. Often we want to do more things that are going to be strengthening the core and strengthening the pelvic floor. So things like Ardha Chakrasana can be really good. Gomukhasana is one that we often do as well. Then premature dilation of the cervix. So for some women, the cervix will start dilating too early. And when the cervix starts dilating, there is a chance that baby's going to come early. So as we've already been mentioning, we don't want to do squatting positions if there is a chance that baby's going to come early, because that can encourage the labor starting. So that's where we move to things like preterm labor. So we're avoiding the squatting. Supta Vajrasana can also be, is also not recommended because it can be too strong onto the belly if those symptoms are coming up that the labour might come on early. And for some women, if they've had already one pregnancy, they might know that they have a tendency to carry their child a little earlier, not for as long. Then we've got rib pain. So we want to avoid slouching. We want to be really careful of our position. So making sure that we keep the spine upright, we keep the chest open. And for some women, if they are having rib pain, they might not feel comfortable to stretch their arm up above their head. For some, because it's just uncomfortable. Sometimes the rib pain can be there not from posture, but because the baby's position and the baby kicking into the ribs a lot. And I'm sure many of you in the class have been pregnant before, so you understand how it can feel when a baby gives a really big kick into the ribs. It's painful. Then we've got sciatica, slip disc. So sciatica is where the sciatic nerve is running down the spine, separating into two, and the compression is there on the sciatic nerve, which creates pain in the lower back. If it's strong, then that pain is going to go down into the bottom, and it can even go down the leg all the way to the foot. There can be pain, numbness, tingling. And if you see the picture here down below, so you'll see this is the first trimester is on the left, second trimester, belly's getting larger and that lower back starts to curve. And third trimester, there's even more curvature of the lumbar spine. So there's more of a tendency towards sciatica, or that pressure being put onto the sciatic nerve. And especially anyone who has had sciatica in the past, there's a much higher chance that it's going to come back if they're pregnant. So there's lots of poses like I was mentioning for back pain, same kind of thing you want to be aware of. Many asanas are there that can help with sciatica. Then sacroiliac pain. So if you look at this picture, you'll see the sacroiliac joints here, okay, between the sacrum, which is our main one here you can see, and then our iliac bones. Okay, so between there's the sacroiliac joints, and there can be pain in that area. And this is especially if the woman does a lot of pelvic opening, strong pelvic opening, and there is a tendency, especially in yoga practitioners, for women to have more sacroiliac pain because they overdo it. They may become too flexible without the strength. So especially if they do a lot of, say, lunges, they do a lot of like the splits type stuff, that can all create more problems. So like I was saying, with all the back pain, you can follow all of that. Is going to be most helpful, but especially everything with really open pelvis needs to be avoided. Then looking at symphysis pubis pain. So if you look at this picture, you'll see again the joint here at the front of the pelvis. So that pain can sometimes be there. So again, we want to avoid all of those strong opening positions, the lunges, the pigeon, and squatting positions too. Horse pose is another version of squatting. So avoiding those. Then the split abdominal muscles. So I talked about them just a little bit. So it's basically, it is going to be happening that they will separate during pregnancy. But for some, it can be too much. Now, mostly we talk about this in postnatal because when a woman has given birth, the muscles will kind of come together and they'll knit together and everything will be fine. But for some women, there will be a gap between the muscles. So it's if there is already a lot of separation, or if they've had a separation beforehand, if they're onto their second pregnancy and that separation is still there, they didn't do the work to kind of put it together, then they need to avoid side bending, back bending and twists, just doing very gentle versions. And as you'll see this point, that there are links between excessive amounts of abdominal exercise in that first trimester. So that's something that we need to be aware of, because There's a lot of different ideas about what to do in the first trimester, and some people say, oh, it's okay, you can keep doing your regular exercise. But actually, you do need to change things in that first trimester because that can have strong effects later on. And then this last slide here of toxemia. Of course, toxemia is a really, really severe condition, and I highly, highly doubt that any woman would ever come to a class if she's having toxemia because she'll be feeling really, really, really sick. So most probably she would immediately be at the doctor and the hospital. And our last one here is about varicose veins. So if she has varicose veins, she needs to avoid any pose that's going to be causing any kind of discomfort, so any pressure. So thinking of sitting positions, she needs to take care of that she's not going to be pressing on that vein, and avoiding standing poses for too long. So it's really important that she puts her legs up. The more she does that, the better it's going to be for her. So that's just some of the different things we need to take care of in pregnancy. Carry on.